Accidents and injuries can cause you to forget how to walk in a balanced way. Now we can put to good use much of the coordination we've achieved when we worked on twisting, hip hikes, and releasing and lengthening the back. These movements simulate the normal mechanics of walking while out of gravity, so that when you're back in gravity, standing, you can create a new, more fluid pattern of walking. Lie on your back, bringing your knees up to vertical and planting your feet about 3 feet apart, a comfortable distance from your hips. If you're tall and have long legs, you may want to plant your feet a little bit wider apart. Bring your awareness to your right knee. Inhale and gently drop the knee inward toward your left heel. Completely relax the abdominals, waist, and back, and let the pelvis release and rotate up towards the ceiling as your knee drops inward. Bring it back up and repeat this a few more times. Sense the length along the right side of your body as the knee drops inward. Don't try to press the knee down to the floor. Your goal is coordinated and relaxed movement. Notice that when one leg reaches down, the opposite side of your waist contracts. This is what happens when we walk. Notice that your hip joint and pelvis can't roll if your back and abdominal muscles are tight. That's because this movement comes from your back rather than from your legs. If the center of your body is tight, your pelvis won't relax and rock, and you won't be able to drop your knee and leg down in the direction of the opposite heel. Now, let's do that several times with the left knee. Inhale and drop your left knee inward. Your knee moves inward but also downward. This lengthens and relaxes the waist, back, and abdominal muscles. Try and keep the non-working leg as vertical as possible and let your pelvis roll to allow the movement to occur. Don't force anything. Notice how the release in the center of your body allows your knee to drop inward. Your knee isn't doing anything, it's simply responding to the suppleness in the center of the body. And now let's alternate the legs, dropping the right knee in, bringing it back up, then dropping the left knee in and bringing it back up. Let the pelvis release and rock. You should feel a smooth rolling on your sacrum as you do this movement. Now finish up the one that you're on. Now plant your feet hip-width apart. Let's expand on the walking lesson movement you just learned. Recall the sensation of allowing your back to lengthen as you dropped your knee and leg inward. Keep that awareness as you take your knee and leg forward over your toes in this next movement. Beginning with the right knee, press down with the right foot on the mat and push the right knee and thigh forward, allowing the right pelvis and back to lift gently. Come back to neutral. Repeat this several more times, gently pushing the knee forward over the toes and then bringing it back to neutral. If you want to bring the knee forward, you have to allow the pelvis to lift and twist a little bit. And your back will arch slightly and the entire right side of your body will lengthen. Now let's do this with the other leg. Press down with your left foot and push your left knee and thigh straight forward while lifting your hip to allow the movement to happen. Notice any difference in your ability to do that on one side as compared to the other. Let the back relax as the knee pushes forward and the pelvis rolls gently. Make it smooth. Now, alternate left and right, pushing first one knee forward, then the other. Notice your hips. Think of the coordination inherent in running. As your leg reaches forward to take a stride, your hips slightly twist forward and your back releases to aid in the movement. Also, when one knee pushes forward and the same side of your body lengthens, your hip contracts on the other side and shortens naturally. Again, this is what should happen with easy, relaxed walking. Finish up the one that you're on, straighten your legs down on the floor, and completely relax.